side of the patient. Normally I would actually, oh, it doesn't have a clip. Normally I would actually do it on the same side as the patient, you know, that it's on, but so that you guys can see me, I'm going to do it from the other side. If your mannequin doesn't have a clip later, let me know. I'll find more. Looks like a couple of them went walking away. So like I said, these guys should already have, except for him, he needs a bag. These guys should already have a bag on them. These clips are kind of cool because they curve a little bit, so you want to make sure that you curve them in the body and not the opposite, right? So that they make sense the way they curve. So knock on door, wash hands, glove up, introduce my patient if I haven't yet, talk to him about what we're going to, you know, change your ostomy appliance today. I've got my supplies. I've got a Chuck's pad, which will just be the towel today. And I'm going to need to empty it first. That's really important because I don't want to mess around with it when it has stool in it. So I want to empty it first. So I need my graduated cylinder. And I don't need this anymore. Other supplies, let's see, I have scissors. I need that. I need a, this is a barrier film. So this is not the paste that, you know, like you put on somebody's bottom. This is like a, almost like a super glue type material that you can wipe on where the dressing is going to stick, and it will dry, and then it will protect the skin so it sticks more to that barrier than their skin. And so if you pull it off, it would pull this off instead of skin, theoretically. So that's what these are. You sometimes see these. Scissors. We don't need the cup and straw. We don't need that. We'll need a couple pairs of gloves for this one. And I don't have any extra washcloths out yet, so I'll use this as my washcloth for cleaning. And a writing utensil. You have to have a pen or a pencil to trace out your circle, which I don't have here. Somebody have a pen or a pencil? Can borrow? Thank you. Okay, so this will be to trace my circle. And I'm going to show you guys using the real ostomy appliance, but then I will also show you what it looks different when you do it for testing with the foam. And there's a bunch of foam ones over there you can play with today too. So wash my hands, done all my checks, told them what we're going to do today. First step, empty the bag, because you don't want to handle a bag full of stool. So you guys emptied an ostomy bag before? Pretty simple, right? A lot of times you'll see people flip the end backwards, right, to keep stool from getting on it, but we're going to change this whole appliance, so we're not going to worry about it. We're just going to empty it out, clip it back up until we are ready to do the rest of the procedure. Then I would make sure clips. Scurry off to the restroom, document the output, dispose of it, etc., etc. So that's done. Thanks, hold that for me. If my gloves are dirty at this point, this is a good time to change them. Put clean gloves on, right? Because they're probably dirty from handling the bottle of the cylinder full of stool. So now I've got clean gloves on, and I am prepared to remove the device. So I'm going to go ahead and take the whole thing off. You can take the bag off separately if you want, but I'm going to do the whole thing in this scenario. And in mannequins, they stick really hard. But, you know, people, you're pushing the skin down as opposed to pulling the device off. And in this case, we'll just get it off of him here. And really the most important thing about doing this skill is not necessarily the changing, you know, the actual skill itself. It's the assessment part of it, right? So once I've got this whole thing off, I've now got this opportunity, we'll pretend like that's new now. I have this opportunity to assess the stoma, the skin around it, everything that was covered up, get a really good look at it, make sure everything looks okay. If I need to wipe any excess stool off, he's actually got a little pussy looking one on him. Check for cap refill on this stoma. Cover it with some gauze so that it doesn't leak everywhere. Then with my washcloth or my wipes or whatever, I'm going to go ahead and continue to assess and clean the skin around it. If you use those bath wipes, you want to go back over with a washcloth and just water, because a lot of them leave behind moisturizers and other things that can impair the sticking of the appliance. If there's a special protection like this that you're supposed to put on, the ostomy nurse will provide that for you. So otherwise, don't put any lotion or anything like that on the skin, because that will keep it from sticking well. So once it's all clean, I'm going to go ahead and put this stuff down all over it so it can dry while I prep the next step. So at this point, I'm probably going to need clean gloves, right, because I just washed him and he was dirty. So I'm gonna get clean gloves now because I don't want to handle the new appliance with dirty hands. And this is one where you can change your gloves as much as you want in testing. That's fine. The instructors actually prefer that because they really want to show that you have an awareness of when you might get soiled, right? What's not clean and what's clean. And I still have this down in case anything drips. All right, so measurement is the next step. We have to measure it. A lot of patients already have a template in their room. So if they've got a long-standing ostomy, it's not going to be like these guys, perfect and round and beautiful. It's probably going to be irregularly shaped, and they've probably got a little card in their room that's all drawn out perfect for it. Otherwise, you may know the standard, like this is pretty obvious probably what size this is because there's lots of circles on it. But so that's helpful. But if it's a new stoma, it's going to change size, right? It's going to be swollen, it's going to shrink down, it may invert, and things may happen. So in this case, I'm going to measure it. I want a measurement that is not too tight. So that's maybe 1/8 to 1/4 of an inch bigger than the stoma itself. Again, on the human being, the edge is much more irregular. It's a lot harder to kind of determine that. But you don't want the appliance to be really tight around the stoma because that can impair circulation. You don't want too much skin exposed because then that can break down. So it's tricky. So I picked the 1.5 on this guy, and so on my plate here, I am going to draw the circle. This is the arts and crafts part. Draw my little circle, doody-doody-doo. And it has usually a circle in the middle to help you out, get started. And then with your nice little, these are great because they're kind of bent at the edge, so you can use them to do this part. Cut it. It's always better to cut it a little smaller at first, right? Because if you cut it too big, then you have a problem. So if you're really not sure, you can always cut a little bit on the inside of your line and then go back later and make it bigger, as opposed to cutting it too much and then you have to throw it away and start over or fill in the gaps with paste or something. Another thing you'll notice, this stuff is kind of neat. It's kind of mushy and bendable. It warms up to the body, and that's what makes it adhere when it's warm. But you'll notice the edge of this can be a little scratchy from your cutting, so it's okay to kind of smooth it out a little bit. And then before you actually stick it on, you really do want to confirm that it's going to fit. And so take another quick second to just check the measurement, and that's just about perfect. So I'm going to go ahead and attach my bag before I attach the device. If you've got a bag that you can't see through, you might have to do this first, right? Because you can't center it if you can't. If it's like this, you can't see where the ostomy is, right? So if you have to do that, but these you can see through. So I'm going to go ahead and attach my bag first. Plus, if my patient is like new surgery, new ostomy, they really don't want me pushing on them while I, because you have to push it on. So you want to snap it on, hear it snap, and know that it's on. If you haven't yet, grab your writing device and time and date it, put your initials, because it is a dressing. And I'm assuming that my barrier film is nice and dry. My hands are still clean because I was just handling the equipment. If I got soiled at all, I'd want to change one more time. And I think we're ready to place it. So I usually take the inner ring off first. And I'm going to place the bag over to the side because he's going to be on bed rest. If he was up walking a lot, I would have it hanging down more. But see, he's on bed rest this week. So, and I'm going to go ahead and center it over the ostomy. Push that part down. And then remove the outer part. Try not to have any wrinkles in it. There we go. And I've got one more bit here that needs to come off. There we go. All right. And then we want to hold pressure on it for about 5 minutes so that it really melds to the skin. So a patient usually can do that for you. You don't want to push hard, but just gentle pressure. And make sure that your clip's on, and make sure that your clip is, like I said, if it's curvy, it's curving the right way towards the body, that it's time and dated. And I think that's pretty much it. At this point, you just document. So for documentation, you want to go ahead and document that you did the procedure, document the equipment that you used, document the appearance of the output from the ostomy and how much there was. Document, of course, your stoma assessment, because that's the big deal in this skill, is that stoma assessment. That the skin is intact, there's no redness, the peristomal skin is intact, there's no bleeding, or if there is, document the type of equipment you used, the brand or the item, so that it's consistent in the chart. And you may even document, you know, that you cut a 1.5 inch hole in the appliance for the patient, okay? For testing, what you'll do that's slightly different is we're not going to tear this thing off. So all the steps will be the same, right? So we're going to empty the bag, we're going to do all that. We're going to come back, and we get to the part where we're removing the appliance. You're just going to take the bag off and talk about the process. So you're going to say, I would remove the whole thing, but for testing, I'll remove the bag. But to remove the sticky stuff, gently push away from the skin. Sometimes you even use like an adhesive remover or something. But for testing, just take the bag off and pretend now that the whole appliance is gone. You can set that aside, put your gauze over the stoma, that's really important. And then you can do all your other steps again, right? So come back, pretend to clean it with your washcloth, assess it just like you would, cover it back up, measure it with your measuring device, getting your size, and then this will be your plate, okay? So then you'll go ahead and draw your circle on this guy and show your cutting technique. And this isn't quite as stiff as the actual ostomy material, but it's a good simulation. So like I said, I figured this trick out a few years ago of a way to try and make it cost effective for you to still be able to practice and kind of have the process, but not necessarily have to use up a bunch of devices. So then you've got your hole, and you would go back and confirm that it's the right size, cover it up, and then this would be where you pretend to place it. So then if it's the right size, you would go ahead and talk about how you would place it and keep pressure on it. You can go ahead and put the bag on instead, because obviously you can't place it without the bag. And then you would be done. You would go on and talk about your assessment, your documentation, etc., etc. Okay? So this is just the in-between. So you make pretend in that phase, so we don't take this off, because these things, you saw how sticky they get, and tearing them off over and over again, plus they're kind of pricey. But each bedside will have one of these today, so you and your partners can play with it and cut it, and you can replace the one that's on there, because some of them are kind of old. If you do find a mannequin that does not have a, make sure you take off your gloves, wash your hands, clean up your supplies, right? Don't touch the sheets if your gloves are dirty. Change them first, or take them off before you tuck the patient in. That's a little thing that we forget sometimes. Like, I'm just handling your ostomy, and now I'm going to touch your bedding. You're going to love that. If you're missing anything, let me know. So, like, this guy needs a clip. But these things should be in the bedside table. And there's a couple jars, a couple bottles of that mannequin lubricant. So just pass it around and share it. You usually only need to spritz